Okay, guys, I'm going to redo C for you. Now we're discussing proposed cuts for seniors in 2026 budget for nation. What I mean by that is title tell y'all senior services at risk throughout the nation refers to a growing concern highlighted by in a WGEL news article about proposed federal budget cuts for 2026 that could severely impact programs supporting older adults across the US. Here's what the surrounding page content reveals. What's at risk? The article the article outlines several essential services that could be affected. Medicaid, a lifeline for many seniors needing healthcare support. Meals on Wheels, critical for food security and social connection. Senior center programs, including assistance, information services, and community engagement activities. Potential consequences. Joy Payf, CEO of Age Smart Community Resources, warns that these cuts could lead to closure of local senior centers, loss of vital support systems for aging populations, increased isolation, and unmet health needs. Call to action. The article urges citizens to contact elected officials like Representatives Mary Miller and Mike Bost. Nikki Brzezinski and Senators Dick Durbin and Tammy Duckworth participate in advocacy events such as statewide day of action on May 28th. Join local efforts like the Bond County Senior Center's information rally to raise awareness and push for full funding of the Older Americans Act. Broader implications. This isn't just about budget lines, it's about safeguarding dignity, autonomy, and access for older adults. The proposed cuts threaten the infrastructure that supports aging in place communities, community connection, and culturally responsive care. Given your deep engagement with aging equity and infrastructure, this moment seems ripe for amplifying participatory advocacy and mapping the ripple effects of these proposed changes. Would you like to co-design a myth-busting brief or toolkit to support local MO the the WGEL article and surrounding page content doesn't provide exact dollar amounts or line item breakdowns, but they do specify which programs are targeted in the proposed 2026 federal budget cuts. Here's a clearer picture of what is on the chopping block. Programs facing cuts. Medicaid reductions here could limit access to health care for low income seniors, especially those needing long term care or home based services. Meals on Wheels funding cuts could shrink delivery routes, reduce meal frequency, and increase wait lists, impacting both nutrition and social connection. Senior Center Services, assistance and information programs. These include help with benefits, enrollment, housing, transportation, and legal aid, community engagement activities, social programming, wellness classes, and caregiver support may be scaled back or eliminated. Policy anchor at risk. Older Americans Act, OAA. The article emphasizes that full funding of the OAA is under threats. This act underpins many of the services listed above. So cuts here would ripple across multiple domains of senior care. Anticipated outcomes. Joy Path, CEO of Age Smart Community Resources, warns that these cuts could lead to closure of local senior centers, loss of vital support systems, increased isolation and unmet health needs. You're interested. If you're interested, we could build a comprehensive matrix showing how these proposed cuts differ from previous years, or map out the cascading effects on rural and marginalized communities. Would you like to co-create a policy brief for or advocacy toolkit to mobilize stockholders around this issue? Billization. The proposed 2026 federal budget cuts, particularly those targeting Medicaid, Meals on Wheels, and senior center programs, pose serious risk to vulnerable populations, especially older adults and rural low income and marginalized communities. Based on the WGEL article and surrounding content, here's a breakdown of the impacts. Direct impacts on vulnerable seniors. Reduced access to health care, Medicaid cuts. Seniors who rely on Medicaid for long-term care, home health services, or medication support may face delays, denials, or complete loss of coverage. Rural elders and those with chronic conditions or cognitive decline are especially at risk. Food insecurity and isolation, Meals on Wheels cuts. Fewer deliveries mean less access to nutritious meals and fewer wellness checks. Housebound seniors often live alone. These lose a vital connection to the outside world. Loss of community anchors. Senior center cuts. Assistance programs, help with housing, transportation, legal aid may disappear. Social wellness and caregiver support programs could be scaled back or eliminated. Closures of senior centers would disproportionately affect those without digital access or transportation. Systematic and cultural implications. Erosion of culturally responsive care. Cuts to the Older Americans Act threaten funding for programs tailored to diverse communities, include language, accessible services, and culturally adaptive interventions. This underestimates equity efforts and widens gaps in care for BIPOC elders, LGBTQ seniors, and immigrant populations. Increased caregiver burden. Family caregivers, often women and people of color, may be forced to fill the gaps, risking burnout and financial strain. Amplified rural disparities. Infrastructure gaps in rural areas mean fewer alternatives when services are cut. Isolation, transportation barriers, and limited healthcare access compound the harm. Given your expertise in mapping infrastructure gaps and evaluating cultural adaptations, this moment feels urgent. Would you like to co-create a ripple effect? Map or stockholder impact matrix to visualize how these cuts cascade across systems. We could also draft myth busting advocacy toolkit to support local mobilization. Community programs are far more than service delivery mechanisms. They're connective tissue in the social infrastructure that supports aging, equity, and resilience. Based on the WGEL article and your documents analysis, here's a synthesis of why they matter, especially in the face of proposed federal budget cuts. Why community programs are essential. They anchor access to care, folks. Programs like senior centers, Medicaid, outreach, and Meals on Wheels serve as entry points to health, nutrition, and social services for rural, low income, and marginalized elders. These are often the only accessible options. They combat isolation, social programming, wellness classes, and caregiver support, foster connection, and reduce loneliness in a major risk factor for cognitive decline and poor health outcomes. They deliver culturally responsive support. Community programs often adapt services to reflect local languages. Traditions and values, especially vital for BIPOC, LGBTQ, and immigrant elders. Cuts to the Older Americans Act threaten this flexibility, widening equity gaps. They empower caregivers. Many programs offer respite, training, and resource for family caregivers who are disproportionately women and people of color. Without these supports, caregiver burnout and financial strain escalate. They strengthen local infrastructure. Senior centers are hubs for transportation, coordination, legal aid, housing, assistance, and digital literacy. The closures, their closures would leave critical gaps, especially in rural areas with limited alternatives. Systems level implications. Community programs are not just nice to have, they're foundational to aging in place. Harm reduction and participatory health equity. The erosion would under, undermine public health goals, increase emergency visit service, increase emergency service use, and institutionalization, disrupt intergenerational and community based care models. Would you like to co-design a framework that maps these functions across different community types: urban, rural, tribal, and let's see, shows how cuts would cascade through each. We could build a toolkit to help local leaders advocate for sustained funding and culturally adaptive programming. Volunteers are the heartbeat of community programs, especially those serving older adults. Their contributions go far beyond logistics. They include and they infuse these programs with empathy, community, and cultural relevance based on the WGEL article and your documents framing. Here's a synthesis of their roles. Core functions of volunteer in senior center or senior services. Direct service delivery. Volunteers often prepare and deliver meals, especially in programs like Meals on Wheels. They provide transportation to medical appointments, grocery stores, or senior centers, critical in rural areas with limited transit options. Many offer companionship visits, reducing isolation and supporting mental health. Program facilitation. Volunteers help run wellness classes, social events, and caregiver support groups. They assist with digital literacy workshops, helping seniors navigate telehealth benefits, portals, and online safety. Cultural and logistic budgeting. In diverse communities, volunteers often act as language interpreters or cultural liaisons, ensuring services are accessible and respectful. They help adapt materials and activities to reflect local traditions, values, and preferences. Advocacy and outreach. Volunteers play a key role in mobilizing community support, organizing rallies, and contacting legislators, as seen in the WGEL article. Call to action. They help distribute myth-busting resources, raise awareness, and recruit others to join the cause. Infrastructure support. Behind the scenes, volunteers assist with data entry, grant writing, and program evaluation, especially in underfunded rural centers. The labor offsets budget constraints, allowing programs to stretch limited resources. System level impact. Without volunteers, many programs would collapse under staffing and funding shortages. Seniors would face longer wait times, fewer services, and increased isolation. Cultural responsiveness and grassroots adaptability for programs would erode, giving your expertise in participatory design and community engagement. Would you like to co-create a volunteer mobilization toolkit? We could include recruitment strategies, role descriptions, and culturally adaptive onboard guides tailored to rural and marginalized communities. Community volunteers, especially those supporting older adults, face a range of challenges that can impact their effectiveness, sustainability, and well being. Drawing from the WGEL article and your documents framing, here's a structured overview of the most common barriers. Operational challenges, limited training and support. Volunteers often step into complex roles, e.g., caregiving, digital literacy, and coaching without adequate onboarding or ongoing guidance. Lack of trauma informed, culturally responsive training can lead to miscommunication or burnout. Resource constraints. Many programs rely on volunteers to fill gaps left by unfunding, especially in rural areas. Volunteers may lack access to transportation, stipends, tech tools, or safe working environments. Role ambiguity. Without clear expectations, volunteers may feel overwhelmed or underutilized, burdened. Boundaries between professional and volunteer responsibilities can create ethical and logistical tensions. Emotional and social challenges. Compassion fatigue. Volunteers working with isolated, grieving, or cognitively impaired elders may experience emotional exhaustion. Okay, so that is C for you. I will see everybody for D maybe if I jump back on later. For now, Gator Wellness, take care, folks.